You may be one of millions of people caught in the middle of the health insurance coverage gap. So if you're in between jobs, there's a gap there. Of course, there are plans offered like Cobra, but often they're way too expensive for most people. So a lot of folks just do without and hope for the best. Or maybe you make too much to qualify for good subsidies, and you make too little to comfortably afford certain premiums. So there's an emerging third option: short-term health insurance. Whatever your reasons for struggling with regular health insurance options, short-term coverage could be for you, as long as you're asking the right questions. So to give the right answers to those right questions is Michael Morrissey. He's with the Texas A&M School of Public Health and has expertise in policy analysis, insurance claims data, and applied econometrics. This guy was recommended for this topic by a colleague of his who said Dr. Morrissey wrote the book on insurance. No, literally, he wrote that textbook. So Dr. Morrissey, thanks for being with us. Clearly, you're the guy to talk on this. So short-term health insurance, that's not something I've heard a lot about in recent years. Is it new?
Well, it's new. It's new, but it's been around forever, basically. But it's always been a tiny little niche market. The idea being, you finished one job, you haven't started the other, you want a little bit of coverage to protect you in between. And that's the role it's played.
So why is it gaining popularity now? Why am I hearing more about it?
Well, you're hearing more about it because the Trump administration has changed the rules of the game. Historically, you could get short-term coverage that would last about a year. What the Obama administration did was to redefine short-term to mean 90 days. It's not very attractive to many people. It's not very popular in the market. What the Trump administration did was to redefine it back to 364 days. And so now you can get coverage for a year. The fact that the penalties on the exchanges are going away means now that you could get this coverage and you don't have to pay a penalty because it's not official coverage. And so it's likely to become popular come the end of this year and into next.
So what is the difference really? Because I get my, I guess, long-term health insurance coverage year to year. So if you're getting short-term health insurance coverage for a year, what's the difference between short-term and regular long-term?
Well, you don't really mean long-term. That's nursing home care, sort of. What you mean is sort of employer-sponsored coverage or the coverage you get off of the exchanges. Those coverages are a year long and they continue. The big difference here is that these are for individuals or for families, and they're medically underwritten, which means that they're sort of the way the individual market looked before Obamacare came along. Which means if you have a health condition, you have diabetes, these probably aren't the policies for you, but if you're young and healthy, or at least healthy, they very well may be a policy for you.
So these are the policies that very specifically look at pre-existing conditions.
That's right. Chances are you will pay a higher premium if you've got health conditions. It may be that certain coverages, maybe for your heart condition, aren't available, or the carrier may say, I'm sorry, we're not going to offer you coverage at all.
Are we looking at, so clearly low premium? I've seen a lot of these that are saying for less than $1 a day, get coverage. So low premium, but possibly very high deductible. Is that one of the things we need to be looking at?
That's right. And if we're talking about policies that are as inexpensive as $30 a month, you really want to look carefully at how generous the coverage is.
Because that's cheap.
That's very cheap.
That's very cheap. So in terms of what we are looking for, who are these policies good for? You've touched on it, but these can be good for some people.
Sure. I mean, you're an individual. You didn't buy coverage through the exchange. You don't have employer-sponsored coverage. Your family's relatively healthy. This is probably a good opportunity to look at it. The premiums are going to be lower because you've got good health, and it's almost certainly going to be cheaper than coverage on the exchange.
But you very clearly need to be looking at things like what is that deductible and what is not covered.
That's right. And whether or not they're going to offer you the coverage given your health condition, because you will pay more if you're sicker.
Sure. We've talked a lot about the Obamacare exchange in this conversation. What will this emergence of short-term health insurance coverage do to the Obamacare exchange?
It sort of depends on how the numbers play out. On the one hand, we've got lots of people who didn't sign up for the exchanges because they were expensive, and so they bought coverage off the exchange or they didn't buy it at all. Those people are likely candidates here. And from that perspective, it doesn't do much for the exchanges one way or the other. On the other hand, if healthy people have joined the exchanges and paid high premiums, this is an opportunity for them to move out, and that means the premiums in the exchanges are go up.
Sure, sure. More movement in the health insurance world, as we've seen.
No dull moments.
No dull moments in your job, right? Dr. Mike Morrissey with the School of Public Health. He's the insurance expert over there. By the way, if you're looking for short-term health insurance coverage, you really want to learn about certain policies, I Googled it just because I was curious, and about 1 million different policies came up. So they're easy to find. You don't need our help. Dr. Morrissey, thank you so much,
My
sir.
pleasure.
Appreciate you.